Welcome to the first episode of NAD NewsPoints On the Air. I'm your host, Mylon Medley, Assistant Director of Communication for the North American Division of Seventh-day Adventist. NAD NewsPoints On the Air is a podcast that features topical, informative conversations about the Seventh-day Adventist Church in North America, its 1.2 million members, educational and healthcare institutions and ministries, and how they impact their communities. Today's guest is Dr. Vincent Hsu. He's a board-certified internal medicine, infectious diseases, and preventive medicine physician at AdventHealth. He also serves as medical director of continuing medical education and assistant director of internal medicine residency program at AdventHealth. He is also an assistant professor at the University of Central Florida College of Medicine. AdventHealth is one of 5 Adventist healthcare institutions within the NAD territory. It is also one of the largest healthcare institutions in the United States, with 80,000 employees operating on nearly 50 campuses in 9 states. Dr. Hsu, thank you so much for joining me today. I would like to get this conversation started. We're here to talk about reentry, something that is on the minds of a lot of people these days as school has restarted and people are going back to work, and more cities and counties are entering advanced phases of reentry. So we just want to talk about how to stay safe and how to keep our loved ones safe. So happy to have Dr. Hsu here to talk about that. But first and foremost, Dr. Hsu, can you give me an overview, or can you describe your role at AdventHealth?
Thank you, Mylon. It's good to be here. My role at AdventHealth is that of a healthcare epidemiologist. It's kind of a big word, but really what we are focused on is ensuring the public health, or the health of our employees, of our staff, of our patients, making sure that we are as safe as possible during the pandemic. Typically before COVID-19, we focus on healthcare-acquired infections, but of course with the pandemic, with COVID-19, it's all been about this virus right now.
Right. And can you tell me how AdventHealth has assisted its community with reentry? I know that your organization, or the healthcare system, has assisted Disney parks. And I even hear that you are assisting the school, your local school system for your local county. So can you touch on that?
I think the first thing to realize is that, no person is an island. Everything that we do within healthcare interacts with the community. So it is to our best interest to make sure that the community is safe. We want to do this as a service, but also recognize that what happens in the community affects what happens in the hospital. So to that end, we do feel a strong, compelling need to talk with every aspect of what could drive the number of cases. And it's going to be institutions in which typically large numbers of people gather. So it's the theme parks, it's sports events, churches, schools, those type of things, because those tend to be a large driver. So we want to make sure that if our community is as safe as possible, that will also translate into a healthcare institution that is as safe as possible for our patients.
And I love how you framed it, that it's really an extension of your mission as AdventHealth to reach your communities. But I was wondering if you can talk a little bit more about how you're helping the school systems and how AdventHealth even assisted the Disney parks.
I'll talk about Disney first. I mean, they are obviously a very large industry that brings a lot of tourists, and we've always had a good relationship. I think it always starts out with the pre-existing relationship you have, and our leadership and their leadership has always had a very good relationship with each other. We learn from them, and so as this pandemic unfolds, they were asking our leadership, how can we again reopen in as much a safe condition as possible. From a school standpoint, we also have good relationships with the schools that we're based in. So the superintendent of the Orange County Public Schools, Barbara Jenkins, had talked to our CEO and said, is there someone who you know that could help out in helping schools reopen? We wanted medical advisory committee. So as a result, Daryl Toll, our CEO, said, maybe Vincent Hsu might be a good person to talk to. He helped us with AdventHealth, and so I'm now the chair of the medical advisory board that advises the Orange County School Board on reopening and safety. And then the same thing occurs with a lot of the churches. Of course, we're active in our communities. Churches are part of that, and so I got a number of requests from different churches about when is it okay to open safely, what do we need to do? And so I thought this is really a good idea to, instead of dealing with each individual church, to kind of talk with you and to be able to kind of discuss some guiding principles for all of us.
Yes, and that's a perfect segue to what we want to talk about today in detail about leaving your home or leaving where you've been, people in general have been quarantined, have been quarantining themselves or their loved ones. So before we get to churches and even schools, let's just talk about leaving your home. Some questions that I and many others have had, particularly about wearing masks. I'm not wearing mine right now because of this interview, but at least in Maryland, it is required when you go into any public space, any buildings, any places of business, masks are required. However, what about if you're walking outside, going for a walk, a casual walk, walking your dog? I have a dog. I walk in a residential area. If you're going for a run in your neighborhood and you're not running into many people, there aren't too many people out in the streets. But if you do see somebody, there's enough space to go to the other side of the road or, kind of scooch on the sidewalk for 6 feet distancing. So in that case, do I need to wear a mask when I'm outdoors?
Yeah, so Mylon, let's start talking about the concepts of risk, in everything that we do. And the first thing I wanted to tell my audience, tell the participants here is that we do need to open up. And unfortunately, there's no such thing as absolutely risk-free. There's always going to be some risk. But given that aspect, there's various degrees of risk from extremely, extremely low to high risk. And the things that you had discussed earlier that brought up about being outside, if you're by yourself, for example, yes, there's virtually no risk of spreading COVID to someone else just because we know how COVID-19 is spread. And it's spread through droplets, heavy droplets, or it can be spread through the air. But if you're outside and you're far enough from someone else, those aerosols disperse and are just so minutely unconcentrated or diluted that it's just not going to pose a risk to anyone else. So the general approach is the further you are away from someone, the better. If you're outside, it's much safer than being indoors because it's so much easier for that air to just be diluted and dispersed. So we start with that. And then, when you start talking about indoors or when you start talking about more people, when you start talking about having to be close, then you need to start talking about masks. You need to start talking about disinfection. You need to start talking about the HVAC or the ventilation, because that becomes increasingly important.
Yeah, so let's stay outside a little more because people, birthdays continue. We're not in graduation season anymore, but, people had parties, people have anniversary celebrations, engagements, and they're taking it outside. And the gatherings can be more than 10 people, or people have play dates for their kids. So in that sense, when you are closer to people, but you're still outside, would you still recommend wearing a mask even though we're outdoors?
Yeah, that's, that is something that is going to have to be a decision for every organization, institution to make. I mean, the safer, if you want to be as safe as possible, the goal is to stay as far apart from each other as possible. From an outdoor standpoint, my recommendation is if you are unable to be further than 6 feet apart or so, I would still recommend wearing a mask, just because it is still possible to transmit, even though the likelihood of transmission is definitely lower outside. If you can't keep that distance, then I would recommend wearing a mask. Now, if you're able to stay 6 feet apart consistently from whatever gathering you have, then the likelihood of needing masks becomes much lower.
Right. And so now let's go indoors a little bit. If we are in an area where we can maintain 6 feet, but we're indoors, are homemade masks or masks that you can buy online, cloth masks, are they sufficient enough to keep us protected from the virus indoors, still able to maintain 6 feet, but are non-medical grade masks enough?
Yeah, masks are still something that we are trying to get more data on, trying to figure this out. We certainly recognize that not all masks are equal. Mm-hmm. And so the commercial grade masks, the cloth masks with multiple layers are thought to be much safer than those in which they have a single layer, or they're more porous, or they're more like net weaving, lace-like. Those are likely going to be very ineffective. Mm-hmm. So what you wear makes a difference, and how you wear it makes a difference. So the advice is to wear as high quality of a cloth mask as possible. If you're not able to get commercial grade mask, make sure it's being worn all the time inside. And even if you're 6 feet apart or more, I would recommend that we wear masks, just because there is the circulation issue, and sometimes these viruses can be dispersed through the air, and what we call them aerosols, and potentially can infect someone else that's even further than 6 feet away.
And how long do these aerosols, especially if we're talking indoors, because right now I don't have a mask on, I'm in this large conference room, but once I leave, how long, if I had the virus, would my infected aerosol stay in the air? And at what risk am I imposing on someone who would come in for a follow or a meeting that will take place right after this? Are they at risk of contracting the virus if I had it and was speaking like this unmasked?
Yeah, there's so many factors that play into how long that aerosol or the virus could circulate. It really depends upon how much air is circulating in the room, how large the room is, or so forth. I mean, the general approach, though, is if you're not too certain, and if the room is relatively small, you don't think the circulation is that good, it could be in the air for actually several hours. If you don't have good circulation. So typically we say a couple of hours for some cases. And again, if you are in a room that's larger or has good air exchange, the ventilation system is working, and perhaps you've got a good filter, then the time that's required to get those aerosols out of there is much less.
Okay, so now let's transition to schools. That's a hot item in terms of news coverage and headlines. And schools meaning anywhere from like daycare all the way to someone in a PhD or graduate school level, people who are reentering classrooms. So if I am, a lot of schools, especially on the East Coast and South, have already begun and have welcomed students into their schools. But if I'm considering to physically remain in the classrooms, or have my child remain in the classroom, what certain factors should I keep an eye out for as a parent or as a student?
Yeah, so some of the things that we had discussed earlier are the factors that need to be taken into schools. And just to kind of go over it again, The further each student is away from each other, the better. Generally 6 feet apart, although we have seen some data that even if it's a little closer, it can be okay. I mean, the further out, the better, but I've heard data that suggests that even 3 feet is better, of course, than being right next to each other. So that would be really a huge factor. The other important factor, as we talked about, is the importance of universal face coverings. The principle is really, if you are not having symptoms, but you could be infected and you don't know it, having that barrier really is effective in blocking the particles and the virus from spreading to others. And then you start talking about other things such as ventilation, circulations of the room, and the availability of disinfectants, hand washing. So those are all factors that play into reopening of schools and being as safe as possible. But I do want to underscore that there's one area that we sometimes forget, and that is just the impact of kids and behaviors and so forth. I mean, it's not only are we talking about, I mean, you can have everything right from an environmental standpoint, but if kids are not going to be wearing that mask, the younger kids may not wear that mask. The older kids may continue to mill around and be close to each other these are old habits die hard. Yeah. So, so it's not just having the right conditions and the spacing, it's also about ensuring that the behaviors that we're so used to doing need to be modified. And that's a huge opportunity in and of itself.
Yeah, because I'm even thinking about colleges, and depending on where some schools are located, students don't stay on campus, they go off campus. And if you're in certain areas where mask coverings aren't required for navigating public spaces, the students can go off campus, take their mask off, or they're at a restaurant and, they're eating, so they're taking their mask off. But then they come back on campus, potentially infected, but, it goes back to what you're saying about ventilation, but we can't control certain behaviors that could increase the risk of contracting this virus. That's what I'm hearing you say.
Oh, exactly, Mylon. I mean, the behaviors are really what's going to drive this. I mean, you've heard about the term the bubble. If everyone was in a bubble, everyone got tested frequently and remained within that bubble, then your chances of acquiring or getting disease and spreading someone else is very low because you are within that bubble. But in college campuses, and especially where there are environments in which you're not able to get tested frequently, that is really one of our big barrier still, is the inability to get students and teachers tested regularly and in a timely manner. You're going to have some issues with transmission.
Yeah, and that's another thing. Even if there is access to testing, the results take a long time. I know earlier this summer, I did have symptoms that caused me to worry if I had contracted the virus. So I went to get tested, but it took almost 2 weeks for me to get my results back. So it was almost like, well, I felt better and, assuming I didn't have the virus, but, at that point, if I found out that I had it, it was just, I wish I would have known that I was negative sooner that day or the next day. And it seems like that's common.
So one of the things that we have advised our schools and the Department of Health, which oversees, of course, the contact tracing and much of the testing results, is that you need to prioritize schools to make sure that you get testing as frequently as possible and that you get the results in a timely manner. Because really, I mean, there's really no other institution, or very few, that reach that area where you've got all the kids congregating together as schools. And so as a result, we want to prioritize and make sure that we got adequate testing for our students and teachers. That is a priority. And we hope that will be the case as our schools reopen.
And do you see, this just came to me, do you see even like a shortage of testing because of all that would be required to ensure the safety of students and teachers on a regular basis? Is there a possibility that we could run out or run low very quickly of tests?
Well, the availability and timing of tests is a function of how many cases you've got in your community. In Florida, in mid to late July, I mean, the delays were a lot worse just because there were so many tests that were being run, and there was the demand just outstripped supply. It's a little bit better now because our cases in Florida are dropping. And so if you are able to be in a community where you don't have a huge number of cases, then you won't have as much of a backlog and you can get testing done quicker. So really, it's really for each community to get their cases as low as possible. That will increase the availability and the timing of your tests. And so one thing that's really important for our viewers to know is that you've got to look at the case rates of your community. You may be living in Hawaii. I mean, it could be anywhere in the States, East Coast, West Coast, and it's important to understand the rates of infection in your community, the percent that are positive, whether the trends are going up or going down, because it's all a local decision. And the United States is such a large, heterogeneous area that you just can't use one number to help it. You've got to use a variety of different numbers for your locality to help you make that best decision.
And I love what you're saying about you empowering yourself. It's one thing to rely on news coverage that could include a region far beyond where you live, but it comes down. So I live in one county separate from where I work. So it would be, upon me to do my own research as well to see whether or not, I could be an informed citizen if I choose to go in and out of certain places. So you're saying, the data is out there. We can all access it.
Yeah, the data is available through the local health department. So for example, if you're a church and you are saying we are thinking about reopening, what are the things that you want to look at? You want to look at the rate of infections in your community, per population. You want to look at the percent of tests that are positive and see whether that's going up or going down. These are the factors that help. We want to empower churches, individuals, schools to look at their data and to make decisions based on that data, because it's not going to be a one size fits all. And unfortunately, sometimes the political structure is that sometimes those decisions are kind of made for you. But in an ideal situation, every institution would make the best decisions based on their own data and based on science.
And I love that you touched on churches, because that's something else I wanted to address. And like you said before, things vary from state to state, city to city, county to county. But, many, as you know, you've already received questions about when can we go back to our physical houses of worship. So when do you foresee, generally speaking, that churches would be able to reopen?
Yeah, so, there's really very little data or guidance on what the actual hard numbers are. The WHO, World Health Organization, has provided guidance that says that you should have less than 5% positivity rates. The number of cases in your community should be less than 100 per 100,000. You need to be having a 50% drop of a certain, there's a lot of different numbers to look at. Unfortunately, the vast majority of our regions in the U.S. are nowhere near that. So you're not going to be able to use those hard guidance at numbers, because you would probably never be able to open, for a long, long time. But the principles are still there. Looking at your community numbers, making sure that your trends are going down, and seeing what other. You can certainly look at maybe there are other churches in the region that have opened, looking to see whether there's any reports of outbreaks or schools. Looking at what we've learned is also very good information to help you make a decision. But at some point, if the numbers look good, other institutions have opened, look pretty good, then I think it's reasonable to start saying maybe we can start doing it safely. And then when you start reopening, I would urge and ask that we start slowly. Don't just all of a sudden say we're going to be at full capacity, but rather, as we have seen in many of the states' phase reopenings, have a phase 1, phase 2. Start with 25%. Ensure the social distancing, ensure adherence to universal face coverings, see how things work for a while, and then as things get better, you can then ramp it up a little bit more. So that would be the general approach that I would advise at the churches when it comes to reopening.
Yeah, and even when we do reopen the physical structures, I'm thinking, so I'm a pastor's kid. I've been around many churches, primarily Black Adventist churches, but just how worship operates and how fellowship operates within a church is definitely not socially distant. It is hard to imagine what that type of service would look like. You know, there's a lot of hugging, there's like close praying, there's singing. And that's another thing. Will we ever get to hear choirs in person again? Because like it seems like singing, you know, you have in way more droplets that are being put in the air. So even how we interact in person whenever that day comes will be drastically different.
Yeah, I mean, there's no doubt that it's going to be different for a while. I mean, and to the point of singing, yes, I would really urge caution about singing, because there's nothing quite like vocalization that really pushes those particles out. And we've seen plenty of data about how singing has really infected a lot of people. I mean, at least early on before they used face coverings. Of course, with face coverings, it's a little bit better, but still, it would probably be one of the last things that I would recommend doing. But I would say this: the fact that you are actually in person is a first step. So yes, recognize we're not going to be where we want to be. No one wants to be. We all wanted to go back and to where it was, and I'm sure that at some point we will be there. But you've got to start somewhere, and just opening it up, just being able to be able to have a few of our members get together in a safe distance apart is going to be a good first step. And I think that will help the congregation recognize that we are on our first steps to getting normal. And I think that will be, first of all, relief to just know that you're able to do that. So I think it's a good thing overall.
Yeah. So what type of fellowship do you recommend in the meantime, until we're able to do that kind of phase 1 of going back to houses of worship? What do you recommend until then?
Well, there are various ways to do that. I mean, I think if you're really trying to take an extremely conservative point of view or approach, you would ask members to come in in their family units. We wouldn't separate the family units, obviously. The family units could be grouped together, for example, in a table, and then each unit of family members could be grouped again in tables a few feet apart from each other, so that you've got that. The stage, could be playing certain instruments, guitar. There could, usually the stage is far enough apart from the audience, and so it's depending upon how your system is, you may or may not require face coverings for those that are on stage. It just really depends upon the situation. But just being able to hear the sermon, for example, in a live setting with some of your other neighbors, I think is really going to be it's going to be a good first step. And that would be my approach. I would avoid, again, I would probably avoid congregational singing at this time, just because we don't know enough about exactly, even if masks are enough to stop that. But again, just start slowly. I would avoid, the hugging and other close contact is something that I would avoid as well. But just get them in the room and start there. If you are in an atmosphere or an environmental situation where you can open the windows, for example, that would be also very beneficial to increase the circulation. I know it's very difficult in hot and humid conditions, though, so it really depends. Start slowly, but again, that first step is still going to be a psychological, I think, benefit to know that we are moving in the right direction.
And until then, we still have to do our Zoom congregations, right? And Zoom prayer meetings, Zoom small groups. I know people are getting so weary of Zoom, but that's the safest course of action right now in terms of how we interact with other members of our faith community.
And there will be some members who just aren't going to feel comfortable going in. They are going to want to continue to Zoom in. So, the churches need to be prepared to be able to accommodate both those that want to come in person as well as those who want to be remote, kind of the hybrid solutions. And many schools are doing that as well. They've got some who come in face to face, others learn remotely, like my children are. They're learning remotely, and we've got to figure out how to do that. I mean, this might be something that doesn't ever go away. Every church may just have streaming options from now on, just to accommodate it. And maybe it's a good thing, that we learn this technology and to our advantage.
As someone who's an introvert, I don't mind at all worshiping from home. I do miss, seeing some people, but, big crowds is something that I generally like to shy away from. So I don't mind Zoom worship, but I know others are really anxious to see other people. So I can extend compassion for those people. So now I want to talk about what it would be like, or when we're able to fully reenter. That seems like a vaccine would be the best way, and feel free to correct me if I'm wrong, but to ensure a safe way to re-enter larger groups of people. We won't be able to do that until we get a vaccine.
There's really only two ways that we are able to achieve the herd immunity that we talk about, where a significant number of immune folks are able to block transmission so it doesn't spread to others. It's either through a vaccine that we're all talking about, because that would be ideal, or you just got to get infected, and that's not ideal, obviously. I mean, people have talked about trying to get herd immunity by infections in a controlled manner. Again, there's a lot of discussion about how to do this, but I think we're all looking forward to getting a vaccine there. Now, just a brief introduction or primer on vaccine development. I mean, this is one area where the political will has really moved so quickly. We've never seen vaccines development, in this type of, given this type of speed before, and that's really good news. But there's going to be a variety of different vaccine manufacturers and there are going to be different vaccines that are available. They may not be equally efficacious. And so you have to realize that, it's not going to be just like a single great vaccine that's going to give you complete immunity. There's no vaccine that's 100% able to protect you, and there's no vaccine that's exactly 100% safe, although you want it to be as safe as possible. The other concern, of course, is that even if a vaccine is available, the time it takes to manufacture for 330 million Americans and get it deployed and distributed and vaccinated, it's going to take months to years to actually get that to get that done effectively. Wow. So, we may hear of a vaccine that gets approved in, for example, November 2020 as an example. But for the time it takes to identify who the most vulnerable, who are the first priority to get it, and then get enough vaccines distributed to everybody is going to take time. So I would urge that we be cautious, that we recognize that our planning isn't to just look at the fact that, a vaccine's approved, we're safe. It's going to take a while. So just remember that. And I think there's some experts that have been talking about, they say probably you should look at 2020, toward the end of 2021, maybe 2022, where we can then say everything is more back to normal. But again, things will probably come in phases as well. So,
Yeah.
it just depends. It's hard to say.
Yeah, but even hearing you say 2021, 2022, I was like, whoa, but that's something that we all have to come to terms with. It's going to take a while. But I'm glad you mentioned, how quickly this is happening in terms of a vaccine development. So I know I have a bit of anxiety about hearing about a vaccine developed so quickly. So can this fast-tracked vaccine development be fully trusted? Should people wait for like a second run, maybe not the first vaccine that comes out, or, so what are your thoughts on trusting how quickly it's coming out? Like you said, a vaccine could be out in a couple months.
Yeah, so that is really a tough question.
Mm.
I mean, you want. I would say that if you can afford to wait, I would probably wait a little bit longer just to make sure that we get more reports about any potential side effects that might occur. Because even after a vaccine is deemed safe and efficacious, there are reports and that have surfaced, for other vaccines, not COVID-19 vaccines, but other vaccines in which there were some side effects that led to a recall of that vaccine. As well. So for those reasons, you want to make sure that there's enough data that's collected. And we call those phase 4 trials. Those are trials that occur after a vaccine is licensed. And there's going to be a lot of pressure to approve a vaccine quicker, even before all the processes are normally taken care of in developing a normal vaccine. Now, there are going to be, but again, we are moving very quickly. And I would say that as time goes on, we are going to be improving to a more normal state. So it's not like you're going to have to act the way we do now for a year or 2 years. I mean, I think we'll be moving closer. So that will be good. But I think for those of us who are able to wait, and just kind of get some data about vaccines and how they're being received and the potential side effects and consequences, I think it would be reasonable to do so. And additionally, I think the prioritization is going to be focused on patients who are really in tough medical straits. For example, those who are in nursing homes are likely going to be first priority to get that, just because they haven't seen the light of day almost, they've been locked up, not able to see visitors. And I think in some groups, the benefits of early vaccination outweighs the risks.
Yeah, wow. So, and also speaking about vaccines, it's making me think of the upcoming flu season. How, if anyway, would the flu season impact what's going on with the coronavirus outbreak?
So Mylon, you touched on a very, very important topic, and this is the issue of influenza. Here's what we know so far. In certain, right now, flu season is occurring in the Southern Hemisphere. So we've got some data from Australia, New Zealand, Chile, for example. And the good news is this: they have not seen a significant number of flu cases. Now, there's many reasons for that. Maybe they've increased the vaccination rates, but probably the most important issue is that the behaviors necessary to prevent COVID transmission are the same behaviors that prevent you from getting the flu. So and the WHO has said that they have not seen so far. They haven't seen a significant winter wave with COVID-19. So the cases have been mild in the Southern Hemisphere. They've been practicing social distancing, universal face masking. We haven't seen a winter wave for COVID. So those are all good things. And hopefully that will translate itself into the Northern Hemisphere. But, and this is a very big but, I think everybody, this is, if you are on the fence about flu vaccination before, this is the time to get off the fence and get vaccinated. If we aren't able to change our behaviors significantly, if there's significant amount of flu transmission that it does occur, and there's by extension, there will probably be a lot of COVID transmission as well. You do not want to get both COVID and flu. Remember, there's a vaccine for flu. There's a vaccine for flu. You should get that. It's not 100% by any means effective, but a little bit of effectiveness is still better than nothing. And what I'm afraid of is that during a flu season, in a society that perhaps isn't able to adhere to the measures to prevent COVID transmission, that we could start seeing a surge of flu cases on top of COVID cases, which could lead to a very bad winter. So we do not want that to happen. So we've seen some good signs from the Southern Hemisphere, but we need to do everything we can in the Northern Hemisphere to make sure that we don't see a different outcome during flu season.
Yeah, because I'm even thinking about the early months of coronavirus coming to the U.S. and the burden it was placing on hospitals and places that offer health care, of so many people getting infected and then having to go to the hospital all back to back to back. And I'm aware that flu season is very busy for hospitals. People may not think, or maybe we're so used to hearing the flu that we don't realize the severity of the flu and the virus and how much is needed to care for people who have the flu. So it sounds like there is a possibility to see another wave of burdening our hospitals and our healthcare providers if there are a lot of people who get the flu and then who possibly also get coronavirus.
Absolutely, because during flu season, you're already kind of at the peak. I mean, at least in Florida, our flu season, January, February, March, tend to be the busiest inpatient seasons where there's lots of admissions because of flu and other respiratory viruses. You add coronavirus on top of that, it could really add for a bad formula. And again, the single best thing that everyone can do to prevent themselves from getting the flu is to get the flu vaccine.
Yep. Well, thank you so much, Dr. Hsu. Is there anything else that I made amiss that you would like to ensure that our audience and viewers take from this conversation? Any, special or very important tips that we should keep in mind as we move forward this year?
I think we talked about the main things. I mean, as we look to the end, I want to end on an optimistic note. I know God will see us through this. We will become stronger people because of this. We are going through a very difficult time, but I don't see this. I don't see this lasting. I only see this getting better as we move closer to a vaccine, as we understand more about this disease. So stay hopeful, stay strong. We'll get through this.
Thank you so much, Dr. Hsu. Again, it's been a pleasure speaking with you. And hopefully we can speak, again, hopefully in a more positive setting. But I, again, just thank you for your willingness to talk to us about this and the information that you've shared and helping us be empowered and informed. So thank you.
Thank you. It was my pleasure, Mylon.
Thank you for tuning into this episode of NAD NewsPoints on the Air. Check out AdventHealth's new coronavirus resource website, specifically curated for faith communities. Go to adventhealth.com/church resources. That's adventhealth.com/church resources. The executive producers of NAD NewsPoints on the Air are Daniel Weber, Director of the North American Division Communication Department, and Julio Munoz and Kimberly Moran, who are the department's associate directors. NAD NewsPoints on the Air is produced, edited, and hosted by me, Mylon Medley. To keep up with news from the North American Division, be sure to subscribe to NewsPoints, a weekly digital newsletter with news stories, special announcements, and ministry resources. Visit NADAdventist.org, then click on news. That's it for this week. See you next time.